Welcome to this guide on common pregnancy complications and how to understand risks and care. In the next few minutes, we'll walk through the most important issues that can affect pregnancy, why early recognition matters, and practical steps that help protect both mother and baby. Think of this as a concise roadmap for safer pregnancies and better outcomes. Pregnancy is an incredible journey, but it also brings specific medical challenges. Understanding the landscape of complications helps families seek timely care and support, and modern medicine has turned many once dangerous conditions into manageable ones through monitoring and targeted treatment. This slide sets the stage for the key risks we'll cover and why awareness matters. Nearly 1 in 3 pregnancies encounters some form of complication, so it's important not to assume everything will always be smooth. Complications can affect the mother, the baby, or both. And early consistent prenatal care is the best defense for spotting problems early and reducing long-term impacts. This slide reminds us prevention starts with routine checkups and open communication with providers. High blood pressure in pregnancy is a quiet but serious threat because it restricts blood flow to the placenta and can deprive the baby of oxygen and nutrients. Left unchecked, it can slow fetal growth, trigger preterm labor, or progress to preeclampsia. So regular monitoring, blood pressure control, and close follow-up are essential to protect both lives. Gestational diabetes happens when pregnancy hormones interfere with insulin, causing elevated blood sugar that can raise risks like large babies and preeclampsia. The good news is it's manageable through careful diet, glucose monitoring, exercise, and medication when needed. And early detection through screening significantly reduces complications for mother and baby. The placenta is the life link between mother and fetus, delivering oxygen and nutrients while removing waste, and when its function is impaired, both lives can be at risk. This slide highlights how placental problems may show up on ultrasound or through fetal growth concerns, and why timely evaluation and monitoring are crucial when placental issues are suspected. Infections during pregnancy, from urinary tract infections to STIs and viral illnesses, can be hidden but harmful, potentially causing miscarriage, preterm birth, or transmission to the newborn. Routine screening, prompt treatment, and preventive measures dramatically lower these risks, so awareness and early intervention are key to keeping both mother and baby safe. Ectopic pregnancy occurs when a fertilized egg implants outside the uterus, most commonly in a fallopian tube, and it's a medical emergency because it can cause internal bleeding. Early signs often include one-sided abdominal pain and spotting, and treatment ranges from medication to surgery depending on severity, so immediate medical attention is essential if symptoms arise. Miscarriage and fetal loss are heartbreaking, but relatively common, with many early losses linked to genetic abnormalities and most happening in the first trimester. Symptoms can include bleeding, cramping, and tissue passage. And while emotional recovery takes time, medical and emotional support are vital for healing and planning future pregnancies when appropriate. Recognizing warning signs early can save lives, so never hesitate to contact your healthcare provider if something feels wrong. Trust your instincts, and remember that timely evaluation for symptoms like severe pain, bleeding, or decreased fetal movement often leads to better outcomes and can prevent complications from getting worse. Some maternal symptoms require immediate attention, including sudden severe headaches or vision changes, intense abdominal pain, or any heavy vaginal bleeding, sudden swelling with breathing difficulty or chest pain, and decreased or absent fetal movement after 28 weeks. So when in doubt, call immediately, because these could indicate conditions like preeclampsia or placental problems. Anemia in pregnancy goes beyond tiredness because blood volume increases dramatically and iron demand can outpace supply, causing weakness, dizziness, pale skin, and shortness of breath. Severe anemia can affect fetal growth, so iron supplementation combined with vitamin C for absorption and an iron-rich diet are common, effective approaches to restore levels and protect development. Mental health is a central part of pregnancy care, as anxiety and depression can emerge or worsen during this time, and they're both common and treatable. Early identification, therapy, support groups, and safe medication options when needed significantly improve outcomes, and addressing mental health helps protect bonding, fetal development, and long-term well-being. Amniotic fluid problems can mean too much or too little fluid, each with distinct risks. Excess fluid can cause discomfort, breathing issues, and preterm labor, while low fluid can restrict fetal growth or compress the umbilical cord. Regular ultrasound monitoring guides management, which may include hydration, rest, increased surveillance, or early delivery in severe cases. Placental complications like placenta previa, placental abruption, and placental insufficiency can disrupt oxygen and nutrient delivery and create emergencies. These conditions often require close monitoring with frequent ultrasounds and fetal heart checks, and depending on severity and gestational age, may lead to hospitalization, modified activity, or urgent delivery to ensure safety. While pregnancy complications can be frightening, prevention and management offer real hope. Early prenatal care, screening, and timely interventions dramatically reduce risks. This slide emphasizes that knowledge, proactive care, and partnerships with healthcare providers create the best path toward healthy outcomes for both mother and baby. Regular prenatal care is your first line of defense, offering comprehensive checks that catch problems early and guide personalized plans. Providers perform blood pressure checks, glucose testing for gestational diabetes, urine screening for protein and infection, anemia testing, ultrasounds for growth and anatomy, and STI screening to tailor care through pregnancy. Small lifestyle choices add up. A balanced diet rich in folate, iron, calcium, and protein supports fetal growth. Avoiding tobacco, alcohol, and recreational drugs reduces serious risks. Managing chronic conditions like diabetes and hypertension is vital, and attention to sleep, stress reduction, and mental health support all contribute to healthier pregnancies and better outcomes. Recent advances have transformed care, from life-saving emergency interventions for ectopic pregnancy and severe preeclampsia to improved diabetes monitoring, targeted mental health therapies, and fetal medicine that can diagnose and sometimes treat problems before birth. Together, these innovations have lowered complications and expanded the options available to clinicians and families. Every pregnancy deserves attentive care, informed decisions, and compassionate support, and understanding potential complications empowers women and families to recognize warning signs and seek help early. Timely intervention and accessible care save lives, and with the right medical support, most complications can be managed successfully, helping families reach the healthy outcomes they deserve.